It is my great pleasure to do this video with Dr. Aron. And the first thing that I want to do is I would love to have you all let us know where I'm going to open up the chat box. Let us know where you are in the world. So we have people, Dr. Aron, I don't know if you can see this, Buffalo, North Carolina, New Hampshire, Charlotte, Atlanta, Delaware, Texas, Canada, Illinois. Great. Thank you all for joining. And then let us know if you're a healthcare practitioner, parent of a child with eczema, or someone who has eczema, or just someone interested. Yeah, peds, nurse practitioner. So we have a variety of parents. We have a pharmacist. Great. Parent of a child with eczema. Florida admin. Oh, great. Welcome. Very good. So all right. So our goal today really is help you understand eczema. And our approach is different because it brings together the best of conventional and integrative or holistic medicine. We treat as the last time I spoke to Dr. Aron is he said from the outside in and the inside out. And that's the beauty of using the Dr. Aron's method that he has created and the integrative process where we're looking at the gut health microbiome. Okay, so what I'm going to share with you how I came to know Dr. Aron's topical and how I met him. And this isn't the patient that I was talking about, but it was very similar, the patient that I saw. So what happened is one of the moms in one of the moms in my practice, we had been working through her eczema through the little boy's eczema for a while. And he would get better, but he was continuing to flare and he would get recurrent MRSA boils, that methicillin-resistant Staph aureus, which I know many of you are familiar with. And we were having to use pretty strong antibiotics to get, to work through it. So this mom found Dr. Aron online, and I'm not exactly sure how she found him, but she said, she brought me this handout, and she said, will you prescribe this for me? And I looked at it and I said, that makes sense. So we started using it, and it was nothing more than revolutionary. It worked quite quickly, and we use that in conjunction with our integrate right with nutrition and gut health and supplements and medications that we need. It's always about the best of both worlds. We never throw the baby out with the bathwater. And so then I reached out, the mom got me Dr. Aron's email, and I reached out to him, and we have been fast friends ever since. And I have been able to meet him at at several conferences. We've been able to meet up when he comes over from South Africa. And so his regimen allowed me to bring together the pieces of the puzzle. And it completely revolutionized the way that I was able to treat kids with eczema. So today, what we're going to go over is the gut microbiome, the skin microbiome, and then we'll touch on nutrition. And I have a lot of free resources that I have listed at the end. So don't worry, it's a lot of really wonderful information to absorb. So just listen, and there are, free things that you can use at the end so that you are able to, to start taking action. Whenever I do talks, I love for people to be able to implement things, tomorrow that you're able to do. And Dr. Aron, I always presume people know him, but I want to make sure that you all realize. So he's been practicing for 40 or 50 years, and he's based out of South Africa, where he practiced a good bit of your career in London, right, Dr. Aron?
Yeah, that is correct. I was in private practice in North London for approximately 20 years, as well as being in practice in South Africa for the preceding 15 years. And I've been treating patients online, essentially worldwide, uh, with particular emphasis on English-speaking countries. I should add that, uh, since 2008, because that was when I found that my results were very consistent. I could forecast how long it would take a patient to respond to treatment, et cetera, et cetera. So that gave me the courage, so to speak, to offer my services online, which I did. I was based in London at the time. And then through a number of coincidences, uh, which I can't, we don't have the time really to go into in detail, but I received a lot of television and press publicity regarding patients that I'd been treating in the United Kingdom. And that led to the expansion of my regimen, quite literally from Eastern Australia to the Western United States. So that is a very, very brief summary of what happened.
Will you share the story? Because I think it's really important to set the stage of how powerful this is and how you're able to do it online, right? There was a television show or a news station that was covering a young girl, I believe, who was she was sort of the person of the month or the patient of the month, right? For
Yes,
eczema.
that is correct. There was a young girl called Laura Weaver, and she was on TV as the National Eczema Society of the United Kingdom. She was the patient of the year. And it was relatively dramatic because it was quite clear that although she was fully dressed, that her eczema was really in a terribly bad state. Extremely active. The face was burning red, crusty and sore. And uh, my wife Kate and I were watching this particular TV presentation. I think it was on Sky News. And I said to Kate, well, you know, what a shame, because I'm I'm certain that we could really help that child. So my dear wife, sort of positive as she always is, said, well, if you think you can help her, why don't you do exactly that? So uh, in a husband's response, dare I say, I thought, but I didn't say, I'll show you, Kate. Uh, so what I did then was I made a number of phone calls, and eventually I got hold of the child's mother. And fortunately, the mother was a state registered nurse in the United Kingdom. And when I explained to Lisa Weaver, the mom, uh, that my entire concept was based on the delivery of a topical antibiotic with a steroid, so that the bacterial infection, which was very apparent to me diagnostically, if you could deliver that to the skin for long enough and tamp down the inflammation with the steroid component and kill off the Staph aureus bacteria with the antibiotic component, one could then get quite a significant result. And that's exactly what happened with Laura, because the mother said, well, that makes absolute sense to me. She said, obviously being well trained and knowing all about skin infections. Uh, and the child did extremely well and then went back onto television as a follow-up, so to speak, a couple of weeks later, dressed beautifully in light clothing because she could now show her arms and her legs. And that led to an absolute explosion of interest in the work that I was doing. And that was the beginning of my uh, worldwide influence, I suppose you could say. However, it's not all been plain sailing, because my treatment addresses two very deep-rooted concerns, concerns to the extent that they could almost be labeled phobias within the profession at large, about the continuing use of topical steroids because of the fear of skin atrophy, the so-called thinning, and also the fear of systemic absorption of the steroid, which might affect the adrenal glands. And these are significant risks if you treat with potent steroids in a continuing and prolonged way. However, the Aron regimen compound is diluted steroids. In other words, I've taken down a potent steroid and diluted it anywhere between 10 and 20 times. Therefore, the dose that I deliver to the skin is well tolerated and can be continued for indefinite periods. Having said that, the problem within the profession in general is that many doctors have been trained to do what I call the stop-start treatment. Now, that is a relatively potent steroid for 2 weeks, then you stop. Then obviously, eczema being a chronic condition, the eczema will recur very rapidly. So then a stronger steroid is provided because the treatment wasn't working, so to speak. So the compounding, which many of the attendees will be well aware of, is very dilute steroid, antibiotic to kill staphylococcal bacteria, diluted in a moisturizer, and that enables continuing treatment. And if I may offer a parallel to this, there are two other chronic conditions which are common in the general population, and they are diabetes and hypertension, namely high blood pressure. So if a patient with diabetes or high blood pressure is successfully treated and the sugar levels in the blood return to normal and the blood pressure returns to normal, the attending providers don't stop the treatment. Obviously not, because otherwise those two parameters will go sky high again. And it's actually the same with eczema. Eczema is a chronic condition, and you have to treat it continuingly and continuously to keep the inflammation and the infection at bay. And that is what I believe I achieve in a large number of the patients that do come under my umbrella of care. And I think that will, I'm open to as many questions as you wish, but that's the broad principles of the AR. I may add, however, that it's not as simple as just providing the single compound, because if you are treating islets, for example, that needs a different treatment. And if you are treating the soles of the feet, that in turn needs a different treatment. And I make adjustments within my regimen to deal with those particular challenges. The other thing, and this is my final word on the subject, if you have very thick areas like on the wrists and ankles, my compounds are too weak, too mild, too diluted to deal with these particular so-called identified areas. So if a patient gets generally clear, but then has these residual areas, they need focused treatments, probably with a potent steroid. So the knowledge and ability to make these adjustments as treatment goes along obviously is central to the ultimate success of the regimen. And forgive me for saying so, I've been doing this for 50 years. So mostly, and let me hasten to say, not always, I have the answer to the atopic dermatitis chronic condition conundrum which faces us all. So I think I'll stop there, as I've rabbited on for far too long, and I will go back to Sheila for her comments.
No, that's perfect. So one of the other thing that happened, that where we connected, Dr. Aron, and I don't even know if I was emailing with one of the administrators of the page or one of the women who helped you, and I had said, oh, I sent them the case and photos, and I said, and we weaned off your topical. And she wrote back and she said, oh, was that a typo? Right. And that was, you kind of elbowed me, or maybe you punched me when we were at the Eczema Expo, when I said that we are often able to wean the compound. And that was, I think maybe it took you a little bit, right, before, and as you and I got to know one another better, and that when we look at the microbiome and we understand what you research is now catching up to what you have been doing and what you figured out using, right, your clinical acumen, what the research was saying, right? The research has been there about the staph. It's just how to treat it. And what we know from research is that it can take at least up to 17 years, maybe longer, before when things research comes out to when it's clinically implemented. Because I think a lot of the questions become, why aren't more people using this? And it's becoming more and more widespread. And there are more and more studies coming out about the benefits of it. And so when we look at it from the that microbiome standpoint and the skin standpoint, there's a two-way street between the two of them. And when you address that staph on the skin, that actually helps to start improving the gut health, which most, even in the integrative standpoint, most people think you have to keep taking foods out in order to get the eczema to heal. And I have a bunch of slides, and I'm going to go through a few of them to get, and if you all don't know, I mean, Dr. Aron is my celebrity friend. He is like a rock star, but he's got a wonderful eczema group, and it's thousands and thousands of patients who've been helped and supported by the regimen that he developed. And I have a book, so I'm a board certified pediatrician in Charlotte, North Carolina, and I started using your topical, Dr. Aron. I think it was around 2012 or 13 maybe. And then I met him at the Eczema Expo in Chicago in 2015. So I had been using the compound for a couple of years before meeting you. And when you look at, I would add a couple of illnesses to what Dr. Aron was talking about in that are similar to eczema, and that often the kids have those constellation of symptoms. They will have asthma, allergies, right? Recurrent ear and sinus infections, constipation or loose stools, belly pain. They might have reflux. And these are all, it's a collection of illnesses called the atopic triad, or the allergic triad. And because the way that we approach this, whether it's asthma, eczema, right, recurrent illnesses, it's very similar to set the foundation from the integrative or the holistic standpoint. And when we're able to use the Dr. Aron's topical for eczema while we're supporting cellular health and gut health, it's really, it's revolutionary in how we're able to help these kids. And so I'm going to go over through this patient who Dr. Aron and I were both invited to speak on it was kind of a summit that was online about this family. And this is the classic, this red, right, Dr. Aron, this is where you see that that's a staph infection. And it almost looks like a burn. And
Correct.
what do you want to say any more about that?
Well, yes, I would like to, because you see, this to my eye is clearly an infected dermatitis. In other words, an inflammation, the scabbing, the crusting, and so forth. And obvious though this is to me, it is a condition which is often underdiagnosed. In other words, the providers don't recognize this necessarily as being infected. So they might then prescribe a topical steroid, for example, because it's the face of an infant, they might prescribe 1% hydrocortisone cream or something like that. And if they do recognize it as an infected eczema, they will then prescribe an oral antibiotic such as cefalexin, one of the penicillins. And unfortunately, oral penicillin or the other antibiotics, they do not really help infected skins for whatever reason. Perhaps there's insufficient absorption through the gut of the antibiotics to reach the skin. It's a long way from the gut to the skin, inside out. And the point is, you need the topical antibiotic. Now, if you give the topical antibiotic, then up comes the next area of concern within the profession at large. And if you give a topical antibiotic such as mupirocin and or fusidic acid or one of the other topicals, what about the potential and the threat of resistance? Now, of course, there's a possibility of resistance, but if you want to fix the skin of this little chap, or uh, um, the fear of resistance should take fifth place. The problem is to actually get the skin clear in the first instance, and then worry about the resistance thereafter. So what has happened is now that the fear of resistance has completely overtaken the use of topical antibiotics. So an effective medication, which if used judiciously could help a large number of patients, has largely been abandoned. And this is not only in the US, but everywhere. Because one of the things, having treated patients for so long worldwide, I can see how they are treating patients in dozens of other countries. And it's all pretty much the same. Fear of steroid side effects, potent steroids too long, fear of topical antibiotics resistance, which is overblown in my opinion, because the results that I get in children like this, and indeed Sheila, which you get, are predicated on clearing the Staph aureus infection. So that is a very, very important point. And I've just had a patient out of Mississippi who was doing extremely well. This is an anecdotal report which I received today. This adult patient was doing extremely well, and her dermatologist in a group practice was providing her with repeats of the compound. The dermatologist retired from the practice. The patient was then reallocated to another dermatologist within the practice, and the other dermatologist then repeated the prescription, advised the patient to apply the cream for 2 weeks and then stop, and then declined to give a refill. That prescription was to last for 1 year. Now, you see, when you run into situations like that, I mean, well, I despair, but that is the hurdle within standard of care conventional treatment guidelines.
And when I hear that, and that's the challenge with things taking so long to get from research into clinical practice. And also when I hear that, I would love for those people to also understand the integrative process, because when we use the compound and we're looking like this little boy is a good example, and he had his mom, he was actually a home birth, but the mom got a uterine infection and ended up needing IV antibiotics for 2 weeks after the birth. And she continued to breastfeed, which meant he was exposed to the antibiotics. And so he subsequently, for months, so that was birth, the eczema developed shortly after that. And I didn't see them until he was about 9 or 10 months old. So his skin looked like this for all that period of time. And they had seen a couple of different dermatologists, and mom had pulled a lot of different foods out of her diet because she was breastfeeding, but the skin continued to flare. So I say this because with the patient in Mississippi, when we go in and we work with the cell walls, we need really healthy cell walls, right? The skin. So once we get the staph treated, if we're baseline not eating the right nutrition, we're still going to, our immune systems may not be working optimally, right? Because even when you have an infection, the antibiotic brings the infection down to a tolerable load to then where our own immune system can take care of the rest of it. And when we're looking at the microbiome, the staph is similar to bamboo, right? If you plant bamboo, it's like a weed. It's going to take over. And by decreasing that staph, it allows the rest of the microbiome of the skin to do its job. And by working with, and I'll talk a lot about fats today, because most Americans, I think most kids in many countries aren't eating enough fat, right? We're the global society now of carbohydrates and ultra processed food. Worse definitely in the US, and other countries have really followed suit with that. But if you don't have a good, healthy cell wall with an adequate amounts of omega-3 fats, and then something called phosphatidylcholine that we use, we're not going to have that nice fluidity of the cell walls. We won't have nutrients going in and out. And then when we do need to use an antibiotic, because we can have flare-ups, and those things can happen. If we have a really good healthy cell wall, it's going to allow the medication to have the best efficacy at the lowest dose with the least side effects. And so as we're able to address the staph infection on the skin, then we bolster the rest of the system. So this little boy also, as we draw labs on the patients, and we do some other specialized testing. We do some deeper urine tests, and we look at stool studies when it's appropriate. And with his blood work, his zinc was very, very low. So in addition to treating the infection, zinc is very important for wound healing, for skin health, for gut health. Zinc, especially those cells that turn over very rapidly. And the skin turns over very rapidly. The GI system turns over very rapidly. So we need to make sure we've got adequate vitamins and minerals to support the system so that we can kind of get to the other side in terms of our immune system and the microbiome. And
Yes.
anything else in that regard?
Yeah, well,
Doctor?
what I would like to say is that for many years, in company with most of my dermatological colleagues, I completely poo-pooed the idea of diet being a significant factor. But probably 10 or 12 years ago, uh, around the time that we met up in Chicago, and in the interests of transparency, I would like to say that I certainly didn't punch you. I don't think I've punched
I'm
anybody.
sorry, I was joking. He looked at me.
I don't think I've punched anybody, least of all a lady, in my life. Anyway, uh, to be more serious, I had a Damascene conversion, and I saw that didn't make sense to isolate the skin because uh, you have to look at it this way. The skin barrier is very important in keeping the skin healthy and normal. Now, the current belief or the received wisdom is that the skin barrier is affected by the genetic makeup of the patient. And that is logical because there's no doubt that there is a distinct genetic component in patients with eczema, asthma, and hay fever. But my view is a little bit different because I think that the skin barrier is damaged by the Staph aureus. So you then get the toxins coming from the outside of the skin going in. Now, once it's gone in, those toxins, I presume, they go into the circulation and they could affect the gut. So if you're going to get remission, in other words, permanent, as close as it can be, healing of the skin, you need to have a healthy gut, a healthy skin, and a healthy skin barrier. I hope that all makes sense. So that is when I was converted to not poo-pooing the concepts which you are so clearly uh, putting forward to the audience. I think it's very important. And just as an aside, and this is a sort of an anecdotal thing, when I last visited my daughter Lucinda uh, in America a couple of years back, uh, I looked at the diet of my grandson, who's a 10-year-old who doesn't have eczema. And when I saw what Lucinda was feeding this little boy, I was horrified. The processed foods, the E numbers, the what's it, the MSGs, etc., etc. And I had a very stern and friendly word with Lucy, and she changed his diet completely, and that's made a huge difference to the child in every respect. So, for general health, the diet is central.
Right. It's always it's a two-pronged approach. And I think we're missing the forest through the trees if we're not looking at what we're putting in our body and really what we're looking at from our environment. And the way that I lay things out in my book is I talk about the 5 triggers of inflammation, right? It's food, environmental allergies, which also, up sometimes 50 with kids with eczema, asthma, it can be 50 to 80% of them can have environmental allergies. So we're always doing, we do labs to check what they're allergic to. So it's food, environmental allergies, environmental toxins, which can be things like mold from a water damaged building, um, infectious diseases, which will be like the staph on the skin, and stress, right? And stress can be physical, it can be emotional. You could have, right? If you have scoliosis, you've got a stressor on your back. But if you have, emotional stress, or if you have stress from the irritation and the pain of itching, that's going to keep your nervous system in fight or flight. And that stress can also be a big trigger of eczema and of itching and the discomfort and the kids staying up all night. So part of what we do at the beginning is we have to put that fire out. And in my experience, that's what your compound does so beautifully while we get these other things started. And I want to go back to what you talked about, though, with the food. So, yes, we've got to make sure that we've got the nutrients that we need. We also, everybody on here, I am sure, has experienced either in their own family or somebody else, the increase in food allergies and food sensitivities. And what the research is now showing, and Dr. Peter Leo, when we were at the Eczema Expo in 2023, I believe is when that research started coming out, or that I had started to understand about it, is how much this disruption of the skin barrier, which the staph contributes to, also contributes to food allergies. And because early on, Dr. Aron, when you and I would be talking, you weren't, because when you get the skin healed, it makes a really profound impact on the gut microbiome and the overall systemic inflammation, that you do get results without necessarily doing all of the other things. And I think the beauty of combining the both of them is that when the system is fortified with nutrition, microbiome, and the skin microbiome, we are able to wean the compound. And we're often able, like this little boy, we went to spot treatment probably within 3 to 4 months. They still used it. They were using it for a year, the spot treatments, but after that, they didn't need to use it. But it also depends on what the underlying, right? Because there are many different triggers, and people who have eczema have a hyperreactive immune system. So something in the environment or the staff or their immune system says whoosh, and they're sending all of these inflammatory cells to the body. And that's also where we don't have fences in the body. So inflammation in one area is going to be inflammation in other areas. And that's why if we have kids with constipation, asthma, they might have reflux, they might be on antacid medications. We just gradually, step by step, we address each thing by treating infections, creating healthy cell walls, supporting the gut microbiome. And in my training, and I think in your training too, Dr. Aron, we just use steroids to quench the fire. And what we do, because there's not only excess inflammation in my book, right? I have a lot of images where I show the cup of inflammation, and it's not only about this cup of inflammation, but there's also immune dysregulation. And that's where getting the cellular health under control is, and supporting the immune system. And we use, again, we're always about the best of conventional and integrative. So we do use other prescription medications, right, including antihistamines, and then medications for the practitioners out there as medications that balance the T helper 1 and the T helper 2 cells in the gut, right? When we have T helper 2 cell overdrive, that's where you get asthma, eczema, allergies. The T helper 1 overdrive are the autoimmune conditions. And so we use different products. We use an aloe that we have. We use something called low dose naltrexone. And then we will use prescription antihistamines. And then as we're able to, we'll switch it out to more natural products that support the histamine when and if possible. But it's always about getting the kids as comfortable as possible, as quickly as we can, because we want them to get into really good deep sleep. That's also, deep sleep is the time that we have do something called autophagy within the gut and within our systems, where we get the cells regenerate, our DNA gets repaired, and we need that good rest in order for our immune system to work properly, and in order for our cellular health, in order for us to get this development. So when it comes to, this was just the history of the little boy. And like I said, mom had, it was on antibiotics. And so those antibiotics, right there, they treated her uterine infection, which needed to happen. But because he was getting it through her breast milk, theoretically, that will, and more than theoretical, that will kill some of the good, healthy bacteria in the gut. And that's where we start to get the imbalances. And this is the cup of inflammation that I'm talking about. And I use these photos as illustrations in my book, is that, right, if you look at Rocky, that little patient at the beginning, he's got a cup full of inflammation. He also had reflux, he had constipation. And then we get these things under control and we bring his cup of inflammation so it's more minimal. And that's where the immune system and all of his systems are able to work properly. And this was, I have the photos dated. So September, January 2020, and we started the compound, and he had a really bad ulcer on his arm that was not healing. And they would use strong steroids on it, and it would continue to flare. And again, mom had been off of many different foods. And so these foods are the foods, these 11 foods cause 90% of our issues between food allergies and food sensitivities. It doesn't mean they're all unhealthy, and it doesn't mean these all have to be taken out of the diet. It just means that if food is involved, chances are one or more of these are involved. Our goal with this family and with most of our families is to be able to open the diet back up. They came to us off of all of these things. And what our blood work showed is that the boy was actually nutrient depleted. So then we had to work to get his cells and get his nutrients, his zinc, his magnesium back to where they needed to be. And then they were able to add in the foods. But we do it all, we do it a step-by-step approach. And we do it with lab work. So what this studies show us is a short course of amoxicillin can impact the gut microbiome up to 6 months. 1 week of clindamycin. Clindamycin is used to treat the MRSA, the methicillin-resistant Staph aureus, and which is the staph that can be on the skin, but you can also, kids and adults can get boils on their skin. But that can affect the Bacteroides community, which is one of the families of bacteria in the gut, for up to 2 years. And people have even been shown to get psychoses with antibiotics, which points to that profound connection between the gut-brain connection. The neurotransmitters, the chemical mediators in our body that affect the brain also impact the gut. And the gut barrier, I love, this is one of the slides that Deb, who is our wonderful pharmacist in our practice, created, that intestinal barrier covers the surface of what is roughly a basketball court. And when we do our conventional training, we didn't learn about the microbiome, right? This research is coming out now. So it's really, conventional medicine is starting to take a look at this and realize how profoundly important it is. What the research is also showing is that it's that two-way axis. So the skin, it's not only the gut affecting the skin, but the skin is affecting the gut, as well as with all of these other systems. And where the staph, again, whether you have eczema or not, if you've got a disruption of the skin, that can contribute to food sensitivities and food allergies if the skin is, when the food touches the skin. All right, and so we talked about steroids and inflammation. And so the way that I like people to think about this is that the gut is, and the skin and many of our in the mouth and the nasal passages, it's teeming. It's like this ecosystem of bacteria. It can be viruses, it can be yeast. So we've got all of these microorganisms. So it's much more nuanced than just, here's, I'm going to kill, an ear infection with an antibiotic. Is we have to make sure that we're kind of tending to the garden as we're treating things. And it's always, we're doing to our bodies what we've done with the soil and with what we're using in our environment. And I think I have so this is because we're doing a lot of things that are not good for us. And as Dr. Aron pointed out, kind of the nutrition that we're giving kids and even the way that we're making food. And in the US, it's a little bit worse than other countries. It's partially because some of what we're allowing into the environment. And you can see since the 1940s, the increase in the rise of eczema, and it can be up to 20-30% in some areas and in some populations. And it's interesting. I think Jason is on here, but as I was preparing some of these slides, when you look at how have we changed our environment in this time, some of the things good, some of the things, maybe not so great, but antibiotics were introduced into humans in the 40s. It was when they became more widespread. And then in the 50s is when we started to put antibiotics into the animal industry, right? We put feeds in the US, in the feed of cattle and pigs, we put antibiotics. And one of the first cases of antibiotic or methicillin resistant Staph aureus was actually in pig farmers in Illinois. And then in the 70s, around 60s, 70s is when we introduced high fructose corn syrup, which is very inflaming, right? We put it in so many foods that are marketed to kids, especially. And then around the 80s is when Roundup, which is that herbicide, was put into the environment. And glyphosate is the active component of Roundup, and that acts as it was originally patented as an antibiotic. And when you look at certain foods, even, common breakfast cereals that are made that have wheat in them, they will test positive for this glyphosate. So, and there's a lot of research being done in this area, and we need a lot more research to understand where are these, why are our levels increasing so high? Why is eczema, allergies, food allergies, why are we seeing such a significant rise? And the factors that we know, back to the microbiome, that drive atopy, which is the allergy, asthma, eczema type issues. It's in utero exposures, right, while mom is pregnant, preterm birth, cesarean section, right? With a C-section, I always say, amen, we're happy that the babies have come out and they're breathing. What happens is the babies come out through a sterile field, right? An incision through the belly. And then if the baby is C-section and bottle fed, they're colonized with this different set of bacteria than the babies who are vaginal delivery and who are breastfed. But what the research also shows is that by the age 3 to 5, C-section babies, we can help shift their microbiome. So I don't want you to think just because if your baby was a C-section, we have a lot of tools that we can use, including probiotics and food. Fiber in food is what feeds the good, healthy bacteria in the gut. And this is, all right, we'll get back to our case here, but this was 3 days after starting the Dr. Aron regimen. And you can see by treating the infection, we get a big improvement. And at least in my experience, Dr. Aron, is we can have it's not always a straight downhill glide, is we have to do a little bit of back and forth as we're, once we're treating, but we keep the compound going until we get the skin completely clear. And then we see if we can just take it to spot treatment once we have their guts fortified and the good fats in their system. And Dr. Aron, this was one of your patients.
Clearly infected. No debate in regard to the two photos on the left-hand side.
Mm-hmm. And then
I would like to just, if I may, make a comment quickly at this stage that in regard to using the regimen, there is the importance of compliance. In other words, how accurately is the treatment applied? And there are many factors affecting this. There are other children in the family. There are other factors where the child may continue to be exposed to external irritants. So it's actually quite a complex aspect. And I just see in your forthcoming slide something about the regimen. So perhaps I'll stop on that comment until we get into the next area.
Yes, so I have now, Dr. Aron, a lot of your slides, and we've talked about a fair bit of them. But I want you to be able to go through. So these were some of the, he and I have done a couple of talks together, and these were the slides from the last time we did a talk. And I think we've gone through some. This was kind of laying out. Do you want, I'll slow down or go faster, whatever you prefer.
Now, do you want me to comment on these
Well,
things,
I think we've talked
or do
about
you
those.
want the attendees simply just to read through it at their leisure?
Yeah, I just want people to see, right? And in the research studies, they were calling it CASM, right? Combined antibiotic, steroid, and moisturizer for atopic dermatitis. So this was a 2-year study. And I'm going to keep going. Here's the gentleman at work. And then this was all of us with Dr. Peter Leo, who he's a dermatologist in Chicago, and he has adopted the Dr. Aron regimen and talks about it and has done some research about it. Do you want to say anything about Dr. Leo?
Yes,
And
I think Dr. Leo was the catalyst for my introduction into America, both physically and online, because what happened there was that uh, it transpired that a number of patients were turning up in his office saying, look, this is the treatment that I would like. And, they would say, and then they would give the prescriptions for the compound or whatever it was at the time. And Peter Leo, amongst many attributes, has a very, very inquiring mind. And he was intrigued by this, where and why were these patients popping into his consulting rooms? So what he did was he invited me to come to talk to his eczema integrative group in Chicago and said, well, why don't you come over and sort of expand on what's going on? And anyway, I duly did that. That was in 2015. And it was a very successful presentation. And things built from there because Prof. Leo had very strong connections with the National Eczema Association of the US. And as a result of that connection and the results that we were achieving, I then was invited on a number of occasions to talk about AR at the Eczema Expo meetings. And subsequently, I think I must have delivered talks at 5 or 6 meetings, twice in Chicago, Phoenix, Arizona, uh, Orlando, Florida. I'm just trying to think, one or two others. I think also a meeting in San Diego. So that was a lot of fun, and I was able to spread. I was able to spread the word of chasm. However, I just would like to be a little bit cautious here. Um, I did not attend the Eczema Expo meeting last year, 2024, in Florida. And that was the first time I didn't attend for probably 8 or 9 years. Very interesting.
I did not realize that.
I think probably they'd had enough of me by then.
No. Mm, Never, you can never get enough. So these are the studies. I don't think we need to necessarily go through them one at a time, but I think it's important to for people to know that it's the
I'll tell you what the importance of this particular paper is that what Prof. Macaulay discovered, I'd actually forgotten about this particular paper, which is really a very important one, uh, that the efficacy of the fusidic acid cream, which is the antibiotic, remained constant. And the efficacy of the betamethasone dipropionate, which is a potent steroid, that faded away as time went along. So it was actually a perfect storm because you want the steroid to be weaker and you want the topical antibiotic to maintain its efficacy so that you don't get reinfection with the Staph aureus. So this was an absolutely outstanding article, but of course, not much attention has been paid to it by the powers that be. And that applies generally to the whole concept of this role um, um, of Staph aureus. And the other thing in regard to your dietary approach within the broad profession, and this included me up until a decade ago. Oh, everybody poo-pooed the place of diet. And
Mhm.
I've come to think that diet is absolutely of central importance and should be followed as closely as possible within the bounds of logistics and affordability and so forth and so on. And
I
if you
would,
do both of them,
I don't think I heard you. What did you say?
must,
I'm joking. The diet.
oh, I see. Yes. Now, there's no question. So the broad profession needs to wake up and deal with diet. But you see, the diet thing is a problem because it's complicated. And we as dermatologists don't know very much about diet. In fact, we know nothing. I know and we know that you shouldn't take E numbers, the colorings and the preservatives in diet. We also know not too much sugar. We know the basics, but we don't understand the fundamentals of, for example, knowing that zinc is important and vitamin D is important in the diet, and these supplements are quite important. And it's a bother, and I use the word in inverted commas for us because we just want to get what we see better, and then the patient is done. And that, figuratively speaking, I'm obviously exaggerating for effect. Uh, so we need to pay as a profession, dermatologists, uh, um, as a broad group of providers, need to improve our perceptions of diet. And we're not trained in how to do it, so we should use the services of integrationist pediatricians or allergists for that matter, uh, to do that side with us simultaneously.
And which is how we just do integrative medicine. We don't do primary care. So people keep their primary care doctor and we just work in conjunction. Like we could even, patients seeing you, we have a health coach who can work with families if you can't, to come and see us, you have to come at least once physically to Charlotte, but our health coach can do things online. We're just restricted with the medical license. Um,
And if I may just add here, you see, if you take allergists as a general profession, they do an absolutely great job on the diet and the gut. And, obviously, if the asthmas and the hay fevers and allergic rhinitis and all that sort of stuff, but they're not trained to treat the skin. They are physicians, they are not dermatologists. So they take a lesser attention to the skin in the same way as we dermatologists take a lesser attention to the gut. And therefore, the patients who are under the sole care of allergists perhaps don't do quite as well as they might. But let me hasten to say, this is my opinion. It's the opinion of a lone wolf howling in the wilderness. You know,
It's an important howl. And I mean, this is why I got into integrative medicine, is because I would see kids who had been to, they would be 3, 4, 5 years old, and they'd already seen a dermatologist for eczema, pulmonologist for asthma, allergist for food allergies or environmental allergies, and GI doctor, maybe they had constipation or reflux, and nobody was putting all the pieces together. And it was right. I was listening to moms, and they would say, Dr. Kilbane, I took Johnny off of dairy and his eczema improved, or his constipation went away. And then they would say, right, because we know eggs and dairy are the two big culprits for eczema. It's not always the case, and but those are what research, this is regular conventional research, is about a third of eczema can be in part triggered by food allergies or food sensitivities, and dairy and eggs are the two big culprits. So it's about bringing all of those pieces together. And I'm gonna go through a few more. Here's another one of Dr. Aron's patients. And this was the
little
little
Australian chap,
Australian, right? I met his mother.
Auntie Thompson.
Yes, she's amazing at the Eczema Expo in Chicago. And so again, a new analysis reveals how Staph aureus gains mutations.
This is quite an important thing, because what it shows in brief summary is that the Staph aureus mutates. In other words, it's there having, the Staph aureus exists normally on the skin. We've all got it. But somehow in eczema, it becomes more pathogenic. In other words, it becomes more aggressive. So it then colonizes the eczema patches. And this is not, obviously, it's not my research, but what this emphasizes is that if you treat the staph, you'll have a better chance of getting the eczema under control. And if you don't treat it, then that patient's going to remain sick for an indefinite period of time. So everybody should just read through the yellow patch just to get an idea, and perhaps make a note of the reference, which is in blue at the top of the slide.
Mm-hmm.
This is genius work.
And it's and we have to put the caveat of that, in both of our experiences, the topical works incredibly well. There are, of course, occasions where it doesn't, and so it's never just a blanket approach. It's very individualized, and you have to, have that close follow-up with patients to make sure that you're monitoring and changing things as needed. But I will say, Dr. Aron, that we pretty much use almost the same concentration all the time for all ages, and we still get the same very good results. Occasionally we'll go a little bit higher with a bigger kid, but most of the time we'll just make a bigger batch of it with that same concentration.
So what is your standard compound then? How much steroid, antibiotic, and base?
We use the 15-gram tube of, and in the US it's mupirocin, and then it's the 22-gram tube of betamethasone, and then the 280 grams of vanicream.
Okay.
Okay, and then this was a paper that I put in here, and this is just showing that now the research is catching up, right? Evidence that human skin microbiome dysbiosis promotes atopic dermatitis. And in a study, they observed a distinct increase of Staph aureus prevalence at age 3 months in infants who later developed atopic disease. And this was 3 months after, right after addressing staph and using the integrative process on this little boy. And the mom was so happy because she had been worried summer, right? We were in wintertime when I started seeing them, and mom was already worried about him wearing shorts in the summertime. And so I think we've made it pretty clear there's a two-way street between the gut and the microbiome. So we need to address both at the same time. And we've have many layers to the skin. And if you go back to the cellular, we have cells, right? We have millions and millions of cells in the whole body. If we're not eating adequate fats and getting the adequate nutrients, every single cell of the body is not going to have adequate fats. And so that's always going back to, and we use omega-3 fats, and we use something called phosphatidylcholine that help make up that really good, healthy cell wall. And digestive enzymes, and this is where, and we treat supplements just like medications. We start things one at a time for anywhere from 3 to 5 or 7 days before starting the next thing, so that if kids have a reaction, we know what they reacted to. Especially kids with significant eczema, they can be super reactive to a lot of different things. And sometimes all we can do at the beginning is the Dr. Aron and an antihistamine. And then we're able to get more of the integrative process once we put the fire out. And this
100% correct, yes. You've got to put the fire out first so that there's a bit of relief for the child. And maybe if the child is sleeping better within 3 or 4 days, there's relief for the family and obviously primarily the mom. So the skin takes predominance because any gut treatment obviously is going to take weeks, if not months, to kick in. So you have to do AR first, followed by complementary treatment in the gut. By all means, start the gut straight away, but the benefits thereof, I think, will contribute to a reduction in the potential for flare-ups if the gut is good. Now that I can't do that scientifically, but it just makes common sense to me. Get rid of the active severe infection, start healing the gut, keep the skin under control. The gut is healthy, the child is feeling better, the autonomic nervous system is starting to work better, everybody is happy.
Yeah, it's exactly. So this is just the visual depiction, and these are all images from my book, right? We've got our underlying genetics and then the triggers of inflammation. And this is one of the research paper that's showing when you have a disruption of the skin barrier, that can contribute to food allergies. And this was the biggest aha. And it's interesting too, is what we do, because I've had many kids that when they get skin prick testing, if they have eczema, they'll get a flare up, right? If they're getting skin prick testing for whether it's food or environmental allergies. So what we do now is I say either we can do it through blood work, but sometimes you need skin prick testing, and we get their skin clear and their gut, we get things going so that we have the fire put out before they go get food allergies. As long as we can do it safely and they're right, we understand what's happening, and if they have any anaphylaxis, making sure they have their EpiPen at home. But understanding this research was an absolute game changer in realizing how profoundly, right? And I just wanted to put this test up there because we can do allergy testing through skin prick testing or through blood work. But just be careful. And then the processed foods that we talked about, and we'll kind of wrap up so that we can take on some questions if Dr. Aron has time. And this is where I do a mini cleanse, and this is like section 2. The first 10 chapters of my book are the science. The second section is the how-to, and then the third section are recipes, and then there's an appendix with references for everything. The whole thing is footnoted. And it's like setting the foundation, right? If you're building a house, you're never going to do the framing if you don't have the foundation set. And if we start adding supplements and, we're doing the Dr. Aron cream and maybe an antihistamine, but we're not doing anything with all of the processed junk food, we're not going to see the long lasting results. Is you're going to need to stay, on the compound and the antihistamine for a long period of time. And I won't go into this right now, but this is all in my book. When food triggers inflammation, it's the 5 different pathways that foods can trigger inflammation. And this is just another case where a recurrent ear infections and eczema. And this was early on. And this was where I started to really understand that profound connection. And it was the mom. She was breastfeeding and he was starting to eat. She took both of them off of dairy and eggs. His ear infections cleared up, as did his eczema. And we talked about the foods. And here's just one of the studies with food. This
You
is
bring your jacket, Drake.
Oh, I don't
Okay.
I don't know, Chloe, if you can see them, if you can mute them. So this was a study, right? This is not new research. This was 91 kids, 4.5 years, who had eczema, remove cow's milk, eggs, or other foods if needed. 74% of the children showed significant decrease in eczema, reduced redness, less excoriation, and decrease that lichenification is where the skin gets thickened. And so when it comes to nutrition, the first thing we generally do, and again, these are all images from my book and the step by step. And we do it gradually. And we start with just 2 supplements at the beginning, because if you start adding in a whole bunch of supplements to a system that's compromised, they're not going to break down the nutrients and absorb them. And supplements can be expensive. So we've got to get the gut set before we start adding in other things. And you don't have to wait a super long time, but we start, and the way that we dose the probiotic is we dose it with start of breakfast and dinner. And that helps to decrease the inflammation. We all get a little bit of inflammation when we eat, and it helps to blunt that impact. And it's a super low dose, single strain probiotic. When you start, at least in my experience, when you start with a much higher strain probiotic, the kids can flare up, or adults. And that happened with Rocky. He had actually started with a different strain, something called Saccharomyces boulardii, and he had a flare up. So we always go back to the basics and set the foundation. And then the second thing we add in is a digestive enzyme. And the enzymes, the undigested food along the GI tract is what the not so beneficial bacteria feed on. And those bacteria make byproducts, and those byproducts are what contribute also to the itching, to the discomfort, to bloating, to constipation or loose stools, and to mood swings. Is you'll notice when kids, right, if their eczema is flared, or maybe they just have constipation and they haven't pooped for 2 or 3 days, they're not going to be the most pleasant people to be around, or adults for that matter. So when the system is working, we decrease those byproducts that the bacteria and the gut are making. And that allows the nervous system, in addition to the immune system and all of the other systems, to work in conjunction with one another. So that's nutrition. And and again, we have just a free eczema jumpstart guide that you can download. It's just sheilakilbane.com/eczema guide. And I think there's a tab right on our website if you go there. And then these are the supplements that I just talked about. The enzymes come in powder, chewable, or capsule. And this was a situation, this little kiddo they'd made a lot of nutrition changes. He had a severe meltdowns. The family couldn't really go out in public. and then when we added the Dr. Aron and the integrative process, this between these two pictures was just a few days, and that was just the addition of it's a Lactobacillus plantarum probiotic. So how probiotics balance the skin, right? And for this purposes, I'm talking about the Lactobacillus species. They also helps to colonize the skin surface so that when we do pull away the Dr. Aron, if and when appropriate, the good healthy bacteria is what's proliferating on the skin. Creates that resistant or that resilient ecosystem, and it maintains the pH balance. Our skin has a pH, it's a little bit of an acidic pH. And when if we're getting this alkalinization and the pH is rising from some maybe not so beneficial bacteria, maybe you're using strong soaps, strong detergents, that's going to change the pH. And so when we get that ecosystem to normal, the pH is also what's going to help maintain the integrity of the skin. And then this, again, I won't go through this, but this, our integrative pharmacist, just made this yesterday, and it's just a beautiful little depiction of all of the things. One of the worst cases of eczema I ever saw was right out of residency, and it was to Glade plugins was the big trigger. The mom had Glade plugins all over the place. I didn't figure that out. It was a dermatologist in Winston-Salem who figured that out. Laundry detergents, cleaning products, soaps and bath washes, shampoos, conditioners, lotions and creams, right? Scented candles. Stuffed toys are harbingers of dust mites, and if you have a dust mite allergy, that's a problem. Furniture, carpets, mattresses. And then if you're doing everything right and the kids are still flaring, make sure they're not being exposed to mold. This is not like mold in a leaf pile, but mold in a water damaged buildings. A lot of the schools around in Charlotte where we live may have some water damage, and the schools usually don't have the money to do the remediation. So we just support the kids' systems. We'll have the families get a nice HEPA air filter to put in the classroom if the school will allow them to. So that's the one thing. And also in my experience, and Dr. Aron, I've reached out to you many times with kids that we get the full body clear and they'll get a recurrent perioral dermatitis. And that's when we see that's one of our triggers to say, all right, make sure that they don't have mold. It's not always the situation, but we've seen it in a few patients where that is the last place where we still start to see it. And but there can be other things contributing to that. Citric acid, if they're all of a sudden eating a lot of oranges or drinking a lot of orange juice, that can also contribute. But as long as you've gone through and they're doing everything right, but still flaring, make sure there's no mold. And again, here's Dr. Aron's website. And here, make sure, grab a copy of my book. And then are the free eczema guide. And then we have a 20% off code if you want to do any of the supplements from our website for the next 3 days, because I know the eczema 20 people are watching this from all different time zones, and we have a book, an online course, brick and mortar practice in Charlotte, and then we also have a workbook on our website. We have an amazing practice, and Chloe is on now and Lauren is on. Thank you, ladies. And if anybody, we'd put a pause in it right now, but if anybody is interested, we have a mentorship group where we teach practitioners how to practice how to treat eczema and other illnesses, but we may just do a sort of a 6 to 8 weeks, a short version of this, so that we just teach our eczema approach. And if anybody is interested, when we have the details, you just support@sheilakilbane.com. Email Tracy at support@sheilakilbane.com. Maybe Chloe or Lauren could stick that in the, and this was our last farewell at the Eczema Expo. Okay, you all have been so lovely, and if we have any questions, it's 11:30, so maybe we'll take 15-20 minutes and answer some questions. So one of the comments, that's the big problem I run into with Western conventional medical practice. There's all the different specialists, but they don't generally look at or know about all the systems that are involved. Yep. Ariana, you're right. 9 years, and docs would not help my son with the rare medical syndrome. In 2 years working with Dr. Kilbane, he is thriving. Oh, thank you, Kathy. He does not have skin issues. Question to Dr. Aron and Kilbane regarding the emollient. We have a compounding pharmacy that uses beef tallow in some of their compound mixtures. Do you see any issues with replacing the Vanity cream with beef tallow? That's a great.
Yes, I do. I'm not familiar with it because I've never used it, but to use an animal product like that, which is probably greasy, is not a good idea. And then if you are putting a steroid and antibiotic into beef tallow, I know of no research that would say to what extent the tallow would moderate or destroy, potentiate for that matter, the steroid and the antibiotic. So I would think that is a no-no.
I agree with that. And what's happened, and it was actually a couple of practitioners from our mentorship group from several months ago, who they were using, I think it was a sheep, like an emollient used from sheep, something from sheep, maybe it was beef, but then the kids went on and developed allergies to the whether it was sheep or it may have been beef tallow. But if you go back to that concept of if the skin is not intact and you're exposing the skin to the certain foods, that can set them up to develop allergies to that. So I would not use the beef tallow. And then Carrie Dempsey, are there practitioners in the Charlotte area for adults? You can, I don't know of any. You can reach out to our practice. We will occasionally see adults very intermittently just for eczema, but just knowing that we don't manage thyroid and high blood pressure and all that kind of stuff. But reach out to our support at SheilaKilbane.com. And then how many grams was the Vanity cream? 280 grams in that particular concentration. And then most of people cannot afford to see you. I did look into having an appointment for my granddaughter. I do purchase Planet Off-Less powdered enzymes and advanced magnesium, plus study and research and listen to videos like this. That's awesome. And Susan, we also do, we're expanding what we're offering now, and our health coach, we can take families on that way at a lower investment point. So definitely reach back out if you feel like you need some more individualized help. And then Oliver said, we are on the Dr. Aron, but want to incorporate the internal component to complete the treatment. Yes, that is absolutely, that's what we recommend. And then, has anyone had experience, Cassie, this is the question that always comes up. Has anyone had experience with raw milk versus pasteurized, or fresh milled organic wheat versus white wheat or any other flour? There's a lot of research that these foods, raw milk and fresh milled wheat, are different for health and gut health, but I cannot find many who are familiar with fresh milled wheat, which is a very rich food. I'm wondering about the experience of others. So we get asked this all the time, and one, if you're getting, there's something called einkorn wheat that you can, it's the ancient grain. A lot of the wheat in the US, even though it's not genetically modified, is in order for if it's not organic, it's most likely sprayed with the herbicide Roundup, because that desiccates the plant or dries the plant up so that they can turn the plant over more rapidly. And So when we're talking, there are a lot of people, I've heard this case after case after case of people who can't eat wheat in the US and they go to Europe and they can eat it. And that would be similar with raw milk versus pasteurized. So when you pasteurize milk, you heat it up and that changes the configuration of the proteins, like the casein protein is one of the biggies that is inflaming in dairy. And then you homogenize it, right? And you push the fat into it and it makes it even more inflaming. But what we do is we get the skin clear and the system solid, and then we reintroduce the foods. And in my book, what I have is, and that's why for it when I was writing the book, I keep adding things on because it's all you, even if you do have to go off of foods for a period of time, it doesn't mean forever. And because the research is so strong between just dairy, for example, and eczema, for most of the kids, we have them go off dairy and or wheat for a period of time, but we wait until we have the skin clear. And then we add those foods back in one at a time for about 5 to 7 days before adding the next food. And it, in the US, we eat so much wheat and dairy. The predominant part of our meals should be vegetables, right? Fruits, nuts, and seeds. Those are the fibers that feed the good, healthy bacteria in the gut. And I mean, dairy and wheat are super yummy. I mean, I don't tolerate wheat, but I do tolerate some dairy, and of course, you always want to eat it. It's super yummy, but so we just have to be careful of the balance. And if there is an issue, then we want to look at it from that form. But yes, those foods do have some really wonderful properties. Yeah, and then there is a difference between raw goat and pasteurized cow. There's an A1 and an A2 protein, and the goat milk is it is easier to digest. It's easier on the gut. All right. Somebody said, should I avoid lemon juice concentrate and citric acid? Asking because those are in so many baby food products in the US. Are those irritating for my baby's gut lining? If the gut is sensitive, anytime you can eat something that doesn't have a preservative, I would do that. And if the baby has eczema, you want to be particularly careful of those things. And the things that I look for is if there are issues around the mouth, and you also want to look at the anus. If there's a bright red ring around the anus, most likely they're eating something that they're sensitive to. Those proteins will come out in the urine and the stool. And so look there. If the baby is super healthy and stools are great, you may not need to worry about it. But if you can, you can make up baby food and then put it in freeze it in ice cube trays so that you can avoid some of the processed foods, the preservatives.
Sheila, may I interject? There's a question from Cassie Boland about the use of tallow. So if I could just repeat my comment that if you put the steroid and the antibiotic into the tallow, there's no way of knowing how the tallow would affect the concentration or the efficacy of those two products, because that would be a very unusual compounding thing to do. So that is the reason why I wouldn't use tallow. And also, I imagine beef tallow is very greasy. And if the skin is infected, the greasiness would be very likely aggravate the infection rather than help it. So beef tallow, I would not use, no.
Yes, I agree. And then Chelsea Bauer said, what if I've done all of the diet stuff and supplements and have got the eczema to reduce to about 25% of what it was, but can never get eczema to completely go away? It's very manageable, very frustrating. that I can never get it to go away. Would Dr. Aron be a good thing to try? Yes, I do think so. And there are, I didn't talk about it, but we also we have a spray called Briotech that we use that's just over the counter that does have staph activity. And it's it's now being the component or the component of it is now being marketed at, like, when we went to the Eczema Expo in 2023, you get a little swag bag of all kinds of things, and there was a little bottle of exactly what's in our Briotech that helps with that. But yes, I think the Dr. Aron would have to know more about the history and the environmental exposures, but that is possibly could be that last residual area that could help. Doing diet and supplements have been for 7+ months. Dr. Aron program has been life-changing for us. That's Felsha Zuklag. That's awesome. Ellen said, just thank you so much. Can't thank you guys enough for saving my daughter. She is thriving. Oh, that's awesome. Thank you. Elver, we're just keeping it through the chat. All right. Felsha said, thank you so much for today's webinar. It is my hope all families suffering from this condition can find your resources and information. Yes, definitely share the info. This Madeline said the staph spread to the inside of my eyes and not around my eyes. After I cleared my skin with the AR, I will get withdrawal symptoms. Will I get withdrawal symptoms from the cortisone eye drops in the long run?
Well, I'll just say that if there is staph in the eye itself, then you probably need a dedicated, specific eye ointment to deal with it. Because if it's the same principle, if you treat an eye infection with steroid only, you're probably going to get suppression of the inflammation for a while, and as soon as you stop the steroid eye drops, it's going to come back again. So you need either a combination steroid antibiotic eye product, like in America, there's one called Maxitrol that does quite well for conjunctival infections, conjunctivitis. Or there's another one called Tobradex, which is tobramycin and a steroid. So you probably need a combination treatment, not a plain steroid.
Yep, I totally agree. And then this is Melissa. She said, my daughter is having great success on AR. We started almost 6 weeks ago. We had some food allergy testing done and found out she has a grade 1 wheat allergy. We decided to cut out wheat from her diet before we started AR. We have seen a miraculous clearing of her skin. Can you talk about the relation of eczema and eating wheat? Yeah, so that's where, if you're eating a food that you are sensitive to or allergic to, that creates inflammation in the gut. And so that's where we've got cells, we've got a single layer of epithelial cells that line the GI tract. So they're supposed to have these nice tight junctions. And if you're eating a food that you're sensitive or allergic to, we get inflammation of the GI tract. Then we start to absorb the undigested food particles, food proteins into our bloodstream. And that's what triggers that cascade of inflammation. That's what people call leaky gut. The medical term is permeable intestine. And when you pull the food out, the gut reseals, and that's where you start to see some of the skin clearing. So that's where sometimes that's for a certain percent of kids with eczema or adults, if it is all or mostly driven by food, if you take the food away, you can get resolution of the issues. It's the kid, like we see a lot of the kids who they've already pulled those foods out and their skin is still inflamed. But I hope that makes sense. And there's great research out of Boston Children's, a Dr. Alessio Fasano, and he did the research that showed, because celiac disease is, right, we know that if you have celiac disease, there's actually something that's called a pathognomonic skin rash that you can get with it. And that's part of it. It's because of that systemic inflammation that you get when the gut is inflamed. But what Dr. Fasano showed, his research showed, is that gluten, which is the protein that's in wheat, barley, and rye, is inflaming whether you're sensitive to it or not. And that doesn't mean it's going to cause a lot of problems for everybody who eats it. But what that means is we've got these nice tight junctions along the GI tract, and that can start to make some inflammation. So again, with your daughter, if it was an allergy and not celiac disease, she may eventually, when you get the skin healed, you leave things healed for months. And I wouldn't reintroduce wheat for probably even a year with her. Get the skin completely clear, get the gut calm, make sure she's having daily easy bowel movements, her immune system, right? She's not getting a lot of illnesses. Then you may be able to, work with your allergist. And in my experience, we're sometimes able to add those foods back in small amounts, right? We don't usually add them back into the same degree that we used to, but that anyway, that's how I'd proceed with that. All right, we may do one or two more questions. Is there a difference in baked raw dairy and quality eggs and removing it from their diet? So that can be, so yes, when you bake something, you change the configuration of the protein, and it's usually less allergenic. And then quality of eggs, if it's a true allergy, you'll be allergic to it, whether it's a poor quality or a better quality. But what the research does show us about eggs that are in the farmyard and, eating worms and things like that, is the omega-3 fat of the content of the egg yolk is higher than the commercially produced eggs. And Jessica asked how many grams for the steroid. Okay, I think we answered that. Okay, thank you for those answers. Cassie said, thank you for the answers. I apologize that Dr. Aron has time to repeat his answer on tallow. Okay, you've got that. All right, I think that is most of the questions. All right, one last one. So Elver asks, Dr. Sheila, should I remove dairy from my son's diet? Drinks whole milk and is not flaring. And then 2, which gut test you recommend if we want to test it? He is clear currently, but still some dry spots. And then Dr. Aron or Sheila, after returning from our home country, Belize, that is very humid, Enzo's dry scalp has come back. How should I proceed with this? Is skin clearing the sign to reintroduce allergens? How can I help to begin healing the skin biome? So those are kind of getting into some complicated. I would grab a copy of my book, and I go through a lot of, how to pull the dairy and to pull it out until the skin clears. And then you can start to reintroduce just small amounts. And if it flares up again, then you would pull it back out. And then with the scalp, because Dr. Aron, do you just want to say a word about the scalp and your topical?
Especially, I mean, is there a scalp question?
It's just said they return after returning from our home country in Belize, which is very humid. Enzo's dry scalp has come back. How should I proceed with this?
No, there's no simple answer to that. Mr. Mangana should direct that question to me through my website rather than I can't cover that because there's such a wide variety of approaches to such problems.
Yep, yep, exactly. All right. Well, Dr. Aron, thank you. I appreciate you so much. And I I want to get to South Africa so we can have a cup of tea. Thank you
Well,
all for
maybe
joining.
we could extend the invitation to lunch or even dinner. You know,
That would be beautiful.
no, but a holiday in South Africa is something to be appreciated. And if anybody has got the time and the inclination to do so, I can highly recommend it, particularly to Cape Town,
Mm.
which has so much to offer uh, people. Um, Cape Town has become one of the premier holiday resorts in the world. I think it's second after Sydney, Australia. So we're sort of quite popular down in Cape Town, although our overall standing in our country perhaps is not quite where we would like it to be. But that's another matter for another day.
All right. Well, thank you. And everyone, we will send out the recording, and we appreciate your time and your patience with our technical snafu. And how, Dr. Aron, this just means we'll have to do another one where we're able to see your face. I'm hoping maybe
I'll
we.
have to get my backup team in place. Unfortunately, the team wasn't available today. But I would just like to end um, by saying that if webinar attenders are not members of my Facebook page, which is Dr. Aron's Eczema Treatment Discussion Group, they would be welcome to join. It's easy to do so. And there's a very healthy and vibrant debate on the pros and cons of treating eczema on that Facebook page. And this would also give me an opportunity to thank my admins. There's a group of primarily women who do an enormous amount of work on the Facebook page, helping patients find healing and relief from their eczema. And I would like to thank them publicly once again. I'd like to mention them by name, but unfortunately, because my memory fails me from time to time, I would inevitably leave someone out, and then I would be in deep trouble by not mentioning their names with the others. So go to Dr. Aron's Eczema Treatment Discussion Group for more information.
That sounds great. Thank you. Yes, and thank you, ladies, and thank you to Chloe and Lauren for getting on and helping to manage. Appreciate everyone so much. All right. Have a great weekend.